Good evening, everybody. I want to welcome you to our annual opioid settlement funding meeting. I'm Ashley Wooten, County Manager. Appreciate you coming out tonight on a cold and damp December evening. We are here tonight as part of the North Carolina Memorandum of Understanding opioid settlement. And so this is a process that all counties entered into with the Department of Justice, with our Attorney General. It's a process that was facilitated by the North Carolina Association of County Commissioners to make sure there was equitable sharing of settlement funds from the various defendants for funds to come out into the communities. So unlike other funding mechanisms that have happened in the past, tobacco comes to mind where lawsuits happened and funding was provided to certain agencies and we maybe never saw that, at least directly. This is very different, of course. All the counties got some amount of funding, and then there's a process for the counties to spend it and have accountability for that spending. So this is what we're here tonight to talk about, some of the things we've done with your help and assistance, some of the agencies that have participated so far are represented tonight. And so our staff are going to go through some of the processes we've been through leading up to now, and then we'll talk about a little bit of the future of what it looks like. And again, the idea is this is to have a community conversation after all said and done here. This isn't the end of it, so don't feel like, oh darn, I forgot to say something that was on my mind. We're an open book. You can reach out to us, make comments known, and then we will obviously make note of those for what your thoughts and desires are as we move forward over time. This is a long-term process. Adrian and I spoke earlier. This is not a hurry up and spend money and get it out the door necessarily, although that's what our goal is, to get funds out of the community, but we want to make sure it's purposeful and going to folks that are going to do good long-term change. So with that, I'll turn it over to Adrian Rivera-Jones, our Deputy Director for Emergency Services, and she'll take it from here.
Thank you. I know most of you in the room, but in case I don't, I'm Adrian Rivera-Jones. I'm the Deputy Director for EMS. And prior to Taylor coming on, who I'm going to introduce in a minute, I had pretty heavy involvement in opioid settlement funds and trying to get those out in the community. And so I've been with you all for a few years at these annual meetings. But I want to get her introduced to you all and let her get familiar with this process. So tonight, some of the objectives will, of course, understand the overdose trends in McDowell County over the last couple of years. I always like to review the MOA and the requirements for anyone who maybe isn't familiar with that process and what that looks like. An update on reporting requirements and some of the things we've learned now that we've done our first annual report. And then the proposal timeline. So we all know Helene came through and kind of wrecked our plans with our proposals and deadlines and timelines for getting this funding out. So talking through some tentative timelines and our goals for meeting those. And then of course, we'll always take questions at the end. And like Ashley said, if you've got questions that maybe you don't think of tonight or you don't want to ask tonight for the sake of time, feel free to reach out to us via email, call me, or Ashley, or Taylor. So, Taylor Leopold is our substance use disorder coordinator, and she was brought on in March of this year. And her role really came on after we started seeing the stringent reporting requirements. So we had an idea about what the reporting was going to look like, but we hadn't actually laid eyes on the templates, because as a lot of you in this room know, when we first done that first round of funding, so 2022 into 2023, we were kind of ahead of the curve in dispersing funds. And so we were using that Opioid Settlement Fund website, which I know we're all familiar with, but I've got a QR code linked to it for you. But we were using that to kind of lay the foundation, but there really wasn't a lot of information about processes, right? There was a lot of gray area. And so we were kind of building the plane as we were flying, is what we were all saying. So once we got the reports and understood what that was going to require, we knew that it was going to be quite the undertaking. Looking at all of the spending plans from other counties across the state, the majority of those counties had this position that existed. And so after learning that and looking through those spending plans, we elected to bring someone on to help us with this. So Taylor's key role is compliance and financial reporting. So the year-end reports, she's responsible for submitting those to OSTAT, and that stands for Opioid Settlement something assistance team, right? So there's a whole team at Raleigh, technical assistance team. And so she works with them to submit these reports. She also works with them to field questions. So if we have a proposal and we're not sure if maybe it falls under the correct Exhibit A, in the MOA, she can run that by them and they can let us know, yes, that goes in that, or no, that doesn't qualify. So she does a lot of that. Community engagement, so she would be our county rep for the NPSA meetings and some of the other community events that we participate in. And then helping to program development and build on our strategic plan that we've all been working on for many years. And so that's her current role. I want to go through overdose trends. I left this slide from our last meeting, so this was actually 2023 data, because I wanted to see what it looked like as I looked at 2024. So last December, you could see we had, this is just EMS too. I always like to let everyone know this is one piece of the puzzle. This is a snapshot from our data. So it's certainly not reflective of everything, and we know that. But we had 217 overdose patients. That includes alcohol intoxication, benzodiazepine overdose. That's not just opiates, that's all overdose impressions. 152 patients received Narcan year to date as of December of 2023. In 2024, we had 134 overdose patients and 78 received Narcan as of today when I pulled the report. So we have seen an overall decrease in overdose call types, and I would say most of our medics anecdotally probably feel that. There was a period of time there post-COVID where we really saw overdoses ramp up and we were responding to multiple a day. That has certainly slowed down. And then same with Narcan. Now, what does that mean on the back end? I think a lot of us who do this work know, as Narcan has made its way into the community, that doesn't mean that less Narcan is being administered. It just means we aren't administering that Narcan, right? And they may not call 911 even though we encourage that. So there's just a little bit of a breakdown there. Most patients that call 911 for an overdose are transported. So 71%, that's like up to the high 90s. So of 134 patients, about 95 of those were transported year to date. So we do encourage them to be seen. And I'll let Taylor take it over for the state trends.
Yeah, so here's just some state data. So this was pulled from NCDHS. Just going over some of the overdose trends in North Carolina. So this was updated as of 11/20 in 2024. So this past year there were 249 suspected overdose deaths that were reported by the chief medical examiner. And that was compared to 348 of the year before. So it's about a 27% decrease in suspected overdose deaths. You can kind of see how it trended for the last few years. And then there were approximately 463 emergency department visits for opioid overdoses, and that's compared to 726 of the year previously. So that's also another 35% decrease overall. So.
Another question we get a lot at our office is how many deaths were there in McDowell? And we know that this data lags. The problem that we have with answering that question is we aren't allowed to report deaths. So if we run a 911 response for a DOA, so someone who's died outside of the hospital, even if we all clues indicate that it's an overdose from opiates, we still can't officially say that. That has to go to the medical examiner in the state and then come back. So that's why that thing takes so long to get back to us. And so we can't report out individually on deaths locally.
So that was the most updated information. And then, so for the last 12 months, opioid overdose ED visits per county, so you can kind of see where McDowell ranks. They were in the 20, I think.
And so there's McDowell, dark green.
Yeah, or greater than 87%. Sorry, I can't see it that far, would you?
So we're in the top counties here for ED visits.
And it looks like we got lowered one.
than previously.
We used to be number one.
So I think while everything's trending lower, I think it's still important to note we're still in one of those higher impact counties for substance use.
And then it kind of breaks it down by age group and then race and insurance coverage. And then this one wasn't as updated, so it's the most updated that they have. That's what I was, the 22.8. It's only up until 2021. That's just because that data has not been updated yet.
And I think that's what's unfortunate is kind of what took off was probably, 2020, 2021, but then I think if we see the last 3 years of data, we would see that number may jump a little bit overall.
And then, so this is a demographics of medication and drug overdose deaths compared to the county population. And again, this is only up to 2021 just because that's the most recent data that they've collected. And it breaks it down into the most common contributing substances for overdose deaths. So
heroin and
fentanyl and then methamphetamine.
All right, so let's talk through it again. A lot of you probably understand all of this, but just to walk through it again, the settlement fund requirements. So there's a local spending authorization report that has to be submitted within 90 days of a budget resolution. So anytime we decide to spend money, we've got to submit that, and that's part of what Taylor does, is submit those resolutions. So that's where when you go on to the North Carolina Opioid Settlement Fund website, you can look at spending plans. So all of those dollars have a resolution tied to them, and you can click and look at each entity. You can look at every county and every dollar they've spent, and you can look through all of those. And it's honestly, it's also good to look at just to see what's happening in other counties, see what resources might be available, and generate some ideas. Annual financial and impact reports. So these are due within 90 days of the end of each fiscal year. And so Taylor just completed our first one. So we quite an in-depth and learning experience for both of us. And then the annual status survey, just a short check-in. And then the annual meeting as part of the MOA is required each year. And so there's obviously this meeting, but then there's other outlets where we can all get together, like the NPSA meeting and some others, where we can keep things moving. Exhibit A versus Exhibit B. The last two times we've went with option A because that's what I've always called the low-hanging fruit. That's that list of strategies that's approved, and you can tie your work into those strategies, and then we can keep funds moving. Option B is a more long-term collaborative strategic planning process, and we'll look at how it's broken down across the state as far as which counties have participated and which ones. So you can see Exhibit A, high-impact strategies to address the epidemic, and 81 local governments have shared plans that approve funding from there. And then Exhibit B, you can see much less utilized, not less important, can just be a little bit more difficult and long-term, but certainly is available. So you can see the counties that have opted to use some for Exhibit B. So lessons learned, and for any of you who've participated in the NPSA meetings, we've had a couple of different sessions where we've talked through lessons learned, both from building the proposal process and also the after side of that, right? So the reporting, originally I think there was some concern about, why are we having to do these quarterly reports if we got funding? And this is the reason, it's pulled straight from the MOA. And again, this is where we were building the plans, we were flying it. They didn't give us a report template. They just said, here are the things we're going to require you to report back to us. And that's not just McDowell County, that's each person that received funding, we have to have these details from them. So that's kind of where this exists. The report that we built really aligns well with these, the sections of the form, with the exception of these two. So the biggest lessons I think Taylor learned, you're going to talk through them, the strategies and the demographics.
So for those of you that have applied for funding, you know that you can elect which strategies you want to put the funding towards. So one of the things that we learned through this is that with the choice of funding multiple strategies, if your organization has multiple strategies that they're putting money towards, we have to get a little more descriptive and break it down a little bit more for each strategy, because the reports require funding and information based on a total strategy, not just reported from your one organization. So if there were 3 organizations that all decided to fund strategy, peer support, but they also had other things like Narcan distribution or things of that nature, it's a combined total that we report on for all, for the singular strategy. So with the with these quarterly reports that'll come out again with this funding, it'll be a little more in depth just to capture that data, and a little more broken down into just some specifics with that. And then the impact report, it actually, they want to try to capture as much demographic information as possible. So some of your quarterly reports might change a little bit to reflect some of that, to try to capture some more demographic information of the different populations that you're interacting with. So, but that'll all be rolled out before the funding is dispersed for the first quarter.
So, tentative kind of update on the proposals and where we're at with those. So we know we obviously sent out the extension, so that went until November 30th. So that deadline has passed. All the proposals that have been submitted are uploaded, and then we anticipate having panel review by January of 25, and I'll get into panel review here in just a minute. With Board of Commissioner review by February. So obviously after the panel selects, that still has to go to the Board of Commissioners for approval. And then tentatively by March, we would hope to notify applicants and then have funds begin dispersing by April. The way that this has worked previously is that funds are sent out quarterly. So if you had a $50,000 award, that would be broken into 4 installments. So you would receive your first one in April, and then in July you would have a report due. You submit your report, next round of installment, report, installment, so on and so forth. That's not to create a barrier, that's truly to create kind of some accountability for both of us. So what we don't want is to get to the end of that 12-month period. You've done great work, you've expended those dollars, and then Taylor's like, oh no, I gotta fill out this 3-page report, right? So we want to make sure that we're collecting that as we go. As a fellow procrastinator, I know that if I have a quarterly report deadline, I'm going to get that done. Also, that information is kind of fresh on my mind, right? So that's why we've elected to do the quarterly report. It's what makes sense for us to make sure that we're getting the information accurately put into that report at the end of the year. So review panel. Obviously, again, this was another casualty of the lean, is that we've still got to create this review panel during the month of December. So we wanted to ensure, we talked through this in our NPSA meetings, is that people who apply for funding don't necessarily need to be on that panel to review. And we kind of had to do some work around on the last one. Again, we were trying to move and get these funds out. And so we've done something that we don't want to do again this time, is that we had people sitting on the panel who also had applications in. They didn't score their own application. They got, why is it leaving me the word? Add them all up. Average. Thank you. Average. Thank you. I'm out of words today. So they got an average score based on every other person that reviewed theirs. And so the hope is that we can get healthcare officials, local government, some public and advocacy groups, and ensure that we've got a nice, well-rounded panel to review these for the month of January. And so we'll keep everyone in the loop on that, just to be able to keep things moving for that February timeline to get these to the Board of Commissioners for approval. These are, again, I put these up here in case if you've never visited the opioid settlement website, I encourage you to do that. It is a wealth of information. Every time I get on there, there's something new. It's actually very user-friendly. Whoever built it did a great job. But looking at the data dashboards, so you can see, again, where everyone and every county across the state has spent their money. And then the payment schedule that'll show you how much counties are getting and at what time intervals those are coming. All of that's available in public. And then the last thing I wanted to share with you all is the landing page for the opioid settlement funds here locally. And this is another great thing that Taylor got accomplished. thankfully, because I certainly wouldn't have done it then, is you can go to mcgalgov.com/opioid settlement funds, apply for funding when it's available. There's a lot of Q&A on there, Taylor's contact info, and then a reminder that you can still request Narcan for your organizations if you need it. Just go there, click that button. It's a very simple form. It goes straight to Taylor. She fills the order and reaches back out to you immediately so that you can pick that up, or sometimes she'll drop it off to you. So I encourage you to continue to utilize that resource. It's still there, and there's still funding available. And with that, what questions are there for us? Or for anyone in the room who could answer them?
Adrian, will there be an opportunity for applicants to have any chance to defend or present their application to the panel? I'm thinking particularly if there's questions that came out of the application.
You know, what we did last time, the panel, if they had questions, reached out to that individual group. Of all the grants I've written, I've never been in one that I've like defended or
I have,
defended
so that's
this or
why I was
whatever.
asking.
So I think we could take that back with us and think about it. Yeah, so we'll take it back. I can't answer that tonight. Yes.
So who selects the panel and how can folks want throw their name in the hat to be selected to be on the panel?
Yeah, so great question. And we don't want to be the sole people who are selecting the panel. I think we're trying to kind of get it moving so that we can get the panel created. And it could be that we send out something where people could apply, and we ensure, just like if I was going to be on a board somewhere, then I'm making sure I'm not affiliated with someone who's applied for funding and moved through that. So yeah, we do want to make sure that we get people who are interested in doing that and that we're making it equitable. So
are you doing the rubric thing?
yep, we do have the rubric, and we'll make sure, I think that was actually on the landing page. The rubric was there ahead of time, so that was one of the after actions. So anyone who applied for the funding had access to the scoring rubric ahead of time, so they understood how they would be scored.
And my last question, so is there not a way to get the organization or whatever agency gets approved funding to get their money all at one time and still do quarterly reports?
You want to answer? You got any?
I think we'll take that one back too, because we've, as a county, we've had different, grant opportunities like that. Sometimes the state, for example, will grant us all the money up front and require the reporting, and some are more trickle out once reports are done, like this one has been. So maybe we can split the difference, or it's one way or the other, but we'll take that back and have to get some feedback on it, but we'll take that into consideration.
Some organizations kind of like, when they're doing their strategic planning or trying to get their budgets together, if they're going to get that funding, it's kind of like trying to figure out where to plug in the numbers and stuff like that.
I would imagine, for example, I don't want to put words in your mouth, but if it's a small organization, you're getting a small amount of money,
Right.
a little bit at a time, it's harder to do something all up front.
Right.
The budgets that we have to do, all the organizations, and please don't misunderstand what I'm saying, $50,000 is important.
Sure.
And build it into the budget, but it's not a huge amount of money when you're dealing with this big of a problem. And that's why logistically, getting the money up front, then you can get people in place and start moving forward. And
Sure.
you can, then your reports have a little more results
Mm-hmm.
than it would when it's trickled out. But it's also hard to get people to do the reports. I
Right,
get that.
it's a give or take, but
Well, you gotta trust us, Ashley.
we trust everybody at that table, so.
Smart.
One thing I'd
Not
like
the
to
one over there, though.
I see that the numbers, that they dropped pretty significantly, both county and state. And, I mean, that's not grand numbers, but that's a pretty good drop. What do you contribute that to?
It's a complex question. I think it's a mixture of, specific to the EMS data, I think it's a mixture of harm reduction, specifically talking about overdose deaths. The reduction in calls, I think, could it mean that we're being successful in our approach? Yes. And are less people calling 911 because they can take care of things amongst themselves? So, yeah, that's a complex question.
Like access, so that's post-Medicaid expansion too. And so for the first time, a lot of people had access to mental health care and physical care, and so that made a big difference.
And there's more numbers too. I'm sorry, I'm sticking my nose in here. But where we need to start thinking about is these are great numbers and things to be happy about. Anytime you're saving lives, that's a good thing. But how many people are beginning to get into substance use challenges? We don't have those numbers. How many programs do we have in place in McDowell County that are either preventing or delaying experimentation among our youth? And if we don't break the cycle of supply and demand, we're going to be having these same conversations 10 years from now. So that's just, there's a lot of numbers in this work, and it has to be, the burden shouldn't all be on EMS to be reporting numbers. The folks that are working in these areas, they have numbers to share too.
It's teamwork.
It's teamwork with all of us. Yeah.
So do you think there needs to be more emphasis put on awareness?
Absolutely. Awareness, true education, beginning with parents, prevention programs, after-school programs for children and middle school kids. And we're working on that. The challenge there is we can show you what numbers are participating in the programs, but it's going to be a while, like several years, 10, to see the real result of this upstream focus work. We have programs that'll be public programs coming out in January, February, and March, where you'll really begin to see the public hopefully getting involved. And we have to stop pretending this problem doesn't exist. And the problem with substance use is not with the homeless population at all, because not all people that are in a homeless situation are involved with substances. And I'm sorry, they asked me, I'm sorry. And the other piece is, these numbers are about opioids. We need to be looking at the full spectrum of substance use. And the emerging population of substance use are people in my age bracket, is the older adults. Because we kind of like our 5 o'clock cocktail, but now we're mixing it with blood pressure medicine and pain medication from hip replacements and all that other stuff. It's a mess.
That was one thing that I was going to say was I spent 19 years in law enforcement, and not all of the abuse comes from somebody that sought out illegal drugs. It comes from drugs that are being prescribed by a doctor, and folks don't know how to handle that. They don't listen to the doctor, number one. Sometimes the doctor don't tell them, don't go into enough detail with them to tell them how to be careful with it. Then they get hooked on it, and some of them overdose on it. So it's not all just illegal stuff.
It's all of us.
That's
it's all of us. Yep. And we need to be better educated. And I would also say that many of our practitioners, particularly with pediatrics and adolescent health, they don't have the training to really know how to find out if a patient who's underage has any situations that they need to be concerned about. And statistics tell us that the adolescent and young adult population are reporting more issues with stress and anxiety than ever before. And there's so much trauma that we didn't know about, 30 years ago, that has to be addressed, because trauma is causing internal pain. And anything to get away from that pain, even for a short period of time, is what people are doing. Now, I do have more to say, but not tonight.
Can you sure? Tim?
So the drop in numbers is kind of a national trend around the nation. Overdose has dropped by about 12%, I think. The theories are it's multifactorial. There's a tremendous drop in medical providers prescribing opioids, so the CDC has had success there. The fentanyl quality has probably changed. That's one theory, that it's not the same strength that it was as of recently. Harm reduction is a huge piece of it, including Narcan distribution and people responding on their own. There's more of a move towards methamphetamine use, so people switching drugs. So there's a lot of reasons that it's a national trend, but as you say, McDowell County is still, even though it's dropping, it's strongly affected in the state. But I think the key is to look at every factor and address every factor. And harm reduction, I'm glad, harm reduction is a huge piece of it, and it's finally being recognized for that and becoming mainstream and accepted by more and more public. So we're very happy about that.
Anybody else? Any other questions? I don't know if it's staying on Tim's great knowledge, but.
With that said, while I sit here, I get 3 texts for a syringe. So the problem remains huge. And so I'm glad everybody's here to address that problem.
I am not.
Not everyone.
And let me just say, also with that said, actually in the one population that the numbers are not decreasing is in the African American population. They're actually increasing. So that is something that needs to be addressed.
Just one more comment, and you're right about the harm reduction. Here in McDowell County, we're looking at harm reduction with just a twist. To us, it's more than syringe safety. But we have placed opioid rescue boxes in key locations. It's kind of like a first aid kit, very prominent, has Narcan in it. We've also placed secure sharps collection boxes, and that's part of our harm reduction effort because nobody wants to get injured by syringes being mishandled and discarded. Part of that harm reduction is also having conversations with folks about legal doesn't necessarily mean safe. So you're right, that's the
Well, I'm
top
going to
thing.
disagree with you. So, and I think it's a misunderstanding of harm reduction. Harm reduction is an entrance into a broad spectrum of people accessing care. So it's only a carrot. When I say harm reduction, it doesn't mean, oh, we hand out syringes. That's a beginning point. And so from there, it's engaging an individual in life transformation. But that's just, harm reduction is a conversation starter.
Mm-hmm.
And an infectious disease
Prevention.
reducing.
Mm-hmm.
But don't stop at syringe access, because that's a tiny piece of harm reduction.
Oh, I agree with you, and that's why we're trying to, at least right now, look at it a little broader, and then we'll begin to narrow it. But right now, McDowell County's not ready.
Well, we're doing
You may be doing it, but
it.
we
We're
are.
doing it in McDowell County. We're doing low barrier Suboxone. We're doing low barrier MC treatment.
I understand.
We're doing low barrier access to, so
I know,
McDowell County may not be ready for it, but
but it is.
here we come.
It is being done, that's correct. That's correct, it is. And we appreciate it.
So we're appreciative that you allow us to.
Of course.
And harm reduction is a tool.
Right.
It's not a solution.
That's right.
And I just want to say that McDowell County's done a really good job at creating a recovery community. But we have to continue to build on that. We can't, it's the same people sitting at the table for how many years now? But what we have to continue to do is create a community where these folks that are suffering with substance use feel comfortable showing up, right? And being honest about their struggles and their suffering at their probation. In every system in the community where they go to access service, we need to continue to destigmatize the issue so folks feel comfortable getting help and support. But harm reduction is a tool, treatment is a tool, prevention is a tool, and we have to use all of those tools to make the impact in the county.
Reduce the supply, the demand, which will reduce the supply over time.
Other questions? Okay. Well, we'll be around for as long as anyone is here, and if you've got questions individually or you want to speak with any of us, feel free to. But thanks for attending tonight. We appreciate your time.